So welcome everyone. We're very happy to have Kevin Shen with us today. He's an analyst for the Clean Transportation Program at the Union of Concerned Scientists. And in this role, he focuses on policies around public transit and transportation planning, and also supports electrification of trucks and buses, and is very busy analyzing the impacts of transportation related air pollution, which is so important, where Emily and James and I are in the Northeast, but really throughout the US and globally, particularly in urban centers. Prior to joining the Union of Concerned Scientists, Kevin had researched these connections between transportation, new technologies, and the workforce with MIT's Work of the Future Task Force. So thank you so much for joining us today.
Thank you so much as well. And so glad to be here with y'all. I think we have a nice small group, so feel free to, put questions in the chat. We can interact more. But I have a bunch of slides and am looking forward to building or highlighting the connections between transportation, climate, and health. And so before we get too far into it, I would love to know who's here in the room today. So if you could while I'm speaking or anything like that, please introduce yourself in the chat. And then also, particularly for me, I work on transportation work. I'd really love to know, how does transportation come up in your work? Elizabeth mentioned that a lot of folks are physicians. Does that come up? How does that come up? I'm very curious as well. So please do so in the chat. And then without further ado, here we go. All right, so my name is Kevin. I work at an organization called the Union of Concerned Scientists, and I wanted to make sure that folks had a little bit of background about what our organization is before I talk about transportation specifically. So, the Union of Concerned Scientists was founded in 1969 by folks at MIT, by students and faculty there. At that time, they were seeing a lot of research funding going to things like weapon systems, and they wanted to see science being used to solve society's problems, kind of instead. And so, almost 50 years later, we have initiatives now spanning from democracy to climate change to still doing a lot of nuclear weapons work, as well as our food system. But I work at on our clean transportation team. So I'm really excited to be talking a little bit more about our work there. We're still, so all throughout, decades later, we're still putting rigorous science to work to build a healthier planet, a safer world, things like that. And then a little bit about our approach. We kind of take a holistic approach on trying to get better policy and things like that out there. We seek to develop solutions informed by science that serve the public, um, also integrating the needs of the most impacted communities out there, whether that's impacted health-wise or climate or transportation. We advocate for science-informed public policy and hold decision makers accountable. So what that looks like is talking to legislators, making sure that the best available science is out there in different policymaking spheres. We organize experts and engage with the public. So that could be like organizations like you all, like the Climate and Health Society. And we want to make sure that you all have the tools to be able to um, use your voice in different ways. And then lastly, we build power by working in solidarity and collaboration with different advocacy, grassroots partners, things like that. So we do all of this kind of stuff, and scientists like you all are incredibly important parts of the ways that we seek to make change out there in the world. And then I wanted to also emphasize one particular note on scientists' role in a more just future. So I think it's important to recognize that science and data have built or have often perpetuated barriers for marginalized people to participate in the scientific process or policy discussions or decisions that impact everyday communities' lives. And so because of this, a lot of the benefits of science and technological advances are disproportionately shared, resulting in like Black, Indigenous, low-income communities and other communities, predominantly communities of color, who are kind of the most excluded from many science or evidence-based solutions. And then even deeper is kind of a history, especially in the transportation space, of science and engineering that has kind of exploited Black and brown folks for others' benefit. There are many examples, for instance, the syphilis study in Tuskegee, to the broad pharmaceutical usage of Henrietta Lacks's cells after her death. And then in transportation world, there's a long history of engineering decisions that have kind of sometimes intentionally divided or displaced Black and brown folks with the interstate highway system. And so recognizing history of how the experts have affected the world in the past, this history is exactly why science and engineering must be active tools to make sure that all voices are heard, that everybody has access to these kinds of solutions and information that shapes their lives, and that in the end, that communities most impacted by societal problems have a role in designing the solutions. So that's kind of a broad framing about how UCS thinks about using science to change the world. I'm going to transition a little more now to talk about transportation. So, why do we care about transportation? Transportation, for one, is in the US, the biggest sector contributing to climate change. It contributes over 28% of all greenhouse gas emissions in the US by economic sector. And then, of particular note, it's one of the only sectors on the right graph, the blue line, that is kind of holding steady or even increasing, while many other sectors have been kind of decarbonizing. So, one surprising factoid that I've heard in the past as well is that if the US transportation system was a country, it'd be the fourth highest emitter in the world. And so there's something wrong with that, where like only transportation in the US contributes so much to to climate change. And then I don't think I have to make this connection for you all, but as you all know, climate change has huge impacts on human health. It's like a very interrelated system. It's not just climate or health or anything like that. So there's a lot of importance to the transportation system and what we do about it. So how do we work on clean transportation at UCS? I guess I should do a little quick story of myself. I was brought up in transportation engineering as like a very technical kind of expert, but I increasingly grew frustrated with the disconnect between like how transportation is in the status quo and contrasting that with the experience of many of the people or loved ones in my life. So I joined UCS as a way to use my technical expertise to change the world in a new way. And so in transportation, this is what we work on. We mainly see transportation with three legs of a big stool. One is on vehicles. So UCS has a kind of the longest history of work on this, on zeroing out tailpipe pollution from vehicles. And so this starts with the need to electrify cars, trucks, and buses, but also includes charging infrastructure, batteries, things like that. Next, another leg of our stool is phasing out petroleum. And so we have a larger campaign focusing on what does phasing out petroleum and fossil fuels look like, especially as it relates to transportation. How can we ease that transition for folks like refinery workers and the communities to be able to actually have responsible state and federal fuels policies that manage that transition smoothly? And then lastly, the third leg of our stool is talking about access. So whether that's more options such as walking, biking, and taking public transit. And so I have a bunch to say about access and its impacts on human health. So I'm going to talk about each of these stools, each of these legs of the stool, and then I would love to discuss more about what you all think, reactions, all that kind of stuff. So without further ado, vehicles. Why do we care about vehicles? Uh, One thing to start with is that transportation contributes to a third of fine particulate matter exposure. So fine particulate matter is one of the biggest um, health harming criteria pollutants, both in the US and the world. And then this is some data from research in 2021, kind of breaking down kind of the sources of where this exposure comes from. And transportation makes up about a third. This comes from both light duty vehicles, such as cars that people drive every day, to the medium and heavy duty vehicles, delivery vans, big rigs, things like that that emit diesel pollution. So all of these contribute a lot to human health harms. But these harms are also not experienced evenly. Transportation and tailpipe pollution is a key contributor to environmental injustices in our world and in the US. For instance, UCS research, we found that, for instance, by race, Asian Americans are exposed to 34% higher fine particulate matter, PM2.5 pollution from transportation than the average person in the US. For Black people, this number is 24% higher. For Latino people, they're exposed to 23% higher air pollution from transportation. And so these not only is this pollution important for everyone, but it's experienced very unevenly. And so that's also a major problem. So in terms of transportation air pollution, what can we do about it? At UCS, we are working on a couple of key strategies that I kind of alluded to earlier. First is kind of electrification. And this map here shows kind of across the country, the average EV, light duty passenger car that everyday people might drive to and from places that they gotta go. On average, the average EV gets an equivalent of 100 miles per gallon. That's good from a climate perspective. That also means EVs are also have lower tailpipe emissions. So there's zero tailpipe emissions at the vehicle, but you can account for the health effects of not tailpipe, exhaust emissions from the power sector. Um, Another thing to note is that with electrification, as opposed to fossil fuel engines like gas or diesel or natural gas, with electrification, the not only is it more efficient today, but as the grid gets cleaner, as we put more renewables online, um, the emissions contribution of vehicles gets just better and better over time. So electrifying vehicles is a key part of the current strategy. It's important to note that. In addition, trucks and or what we call medium and heavy duty vehicles deserve special attention. So in the US, for instance, medium and heavy duty vehicles only make up 13% of on-road vehicles. But when it comes to the actual emissions that come from these, um, compared to all the rest of the vehicles, the trucks and buses are contributing a lot. So they contribute over half of transportation related PM 2.5 emissions, 58% of NOx emissions, 30% of climate warming emissions. So despite being a very small portion of the fleet numbers wise, they contribute a big impact. So there's a lot of other strategies as well to make sure to electrify this sector of vehicles as well. And this is one place where like electrifying one vehicle can go a really long way. Um, and for all of that, whether that is the personal cars or trucks and buses, we need charging infrastructure and better battery policy to kind of manage this transition. And so at UCS, we do a lot of work making sure to ensure EV charging investments, whether that's at the utilities or at the federal level. And then in addition, there's a lot of work recognizing the the harms of mining minerals for batteries for electric vehicles and the ways that we can reduce those harms by things such as increasing the efficiency of electric vehicles, not making them as bulky or big, um, managing the range, reducing vehicle miles traveled with more transportation options, or one big chunk, which can come from increasing the amount that we recycle the existing minerals that we already take out of the earth. So those are two very incredibly important strategies to try and encourage electrification, which in turn helps with transportation-related air pollution out there. What's happening with this area right now? So things are not looking very good at the federal level. So on the left, a couple of things to note. On the left, UCS recently joined a lawsuit challenging the Trump administration's unlawful endangerment finding repeal. For those of you who don't know, the endangerment finding is the finding that a lot of federal regulations rely on that says that greenhouse gas emissions are dangerous to to people and human health and things like that. So the Trump administration is repealing this endangerment finding. UCS is trying to fight back, saying it's unlawful. But in addition to that, one regulation that endangerment finding underpins is the fuel economy standards, or people call that CAFE, things like that. And that is another regulation that the Trump administration is rolling back. These are regulations that regulate the tailpipe emissions from vehicles that use gasoline and things like that. So the Trump administration is actively rolling those back. We are fighting back against those rollbacks, but it's things are rough out there. On the flip side, there's still a lot of actions that states can pursue that might not intersect with the federal government that offer a case for hope. And so on the right, we have these policies called indirect source rules, which are kind of an emerging route towards cleaning up the freight sector, those trucks and buses, or not buses, those trucks and delivery vans and things like that. And so, some examples of this are in places like the South Coast of California, that's like the LA area, Illinois, or New York are considering rules that regulate the emissions around warehouses. So, usually, currently, in air quality regulations, you only regulate the direct sources of pollution, whether that's like a facility that is particularly dirty or something like that. But with the rise in things like e-commerce, there's increased amounts of truck traffic that are coming that are related to many of the warehouses that are popping up around our neighborhoods. And so indirect source rules are one way to make warehouses accountable for the truck traffic that they attract. So two very kind of rough situations at the federal level, some cases for hope at the state level um, in terms of improving vehicles and then as a result improving the air pollution that comes with them. Access. Let's talk about the second section. This is the one that I majorly focus on at UCS. And so I want to highlight how access to wherever you need to go, whether that's the grocery store on the bottom left, or medical appointments, going to work, or even just connecting with people in your life. Access is a crucial part of a healthy life. There's a lot of research that speaks to this. And in particular, there's a lot of research that has spoken to the importance of things like transit to averting social isolation that disproportionately affects older adults, whether that's in urban or rural areas. In addition, in the top right, we have an example of how access also gives a lot of um, access is important for not only older adults, but also youth. That's one way that access is incredibly important for all of us to live the lives that we want to live. Um, but yet, a car-dependent system makes us kind of unsafe and unhappy. So, on the left, we see the big epidemic in pedestrian fatalities due to the kind of car-oriented, highway-oriented system that we have. Um, this trend in pedestrian fatalities is particularly unequal as well, affecting people of color in particular. In addition, if you look across history, um, US DOT has some research that has tallied up all the people who have passed away from traffic since 1899. The tally is over 4 million people. And on average, if you look at the rates today, there's an average of around 40,000 deaths per year, with over 2.4 million people injured every year due to traffic-related incidents. And so I'm sure this probably comes up for a lot of folks who are physicians or who are working in the medical side, but a car dependent system is particularly bad for public health in this regard. Um, but in addition, it's not just physical health, it's also mental health. So there's some recent research that came out in 2025, along with some other past research too, which talks about how car dependence really just makes people very unsatisfied as well with life. So whether that's the time that you have to sit in traffic in order to get to work or do whatever you got to do, whether that's the contributions to a sedentary lifestyle, things like that. a car-dependent lifestyle is and then bad for kind of our mental health as well. There's a lot of research kind of suggesting that. Um, in addition, so a car dependent system is pretty bad. The solution that we see is that more transportation options are necessary to serve all, and especially because over 36% of people in the US do not rely on personal vehicles to travel for their daily needs. Um, whether that is because people are too young to drive, too old to drive, whether people have disabilities that may prohibit their ability to drive. 73% of people with disabilities don't drive for most of their trips, whether they can't afford to drive. Households spend $15,000 per year on their vehicles on average. Um, over 37 people over the age of 75 have driving limitations due to age. But then, in addition, there's a lot of hours spent just chauffeuring others. There's a lot of need to um, kind of split a vehicle with multiple people in a household that can impede people's access to a vehicle. And then in addition, these kinds of issues do not just happen in urban areas, they happen in rural areas as well. And so around 1.8 million people in rural areas are in households without any cars. And those people are particularly affected because a lot of the times rural transit services are particularly inadequate. This all comes from research from the Natural Resources Defense Council. And so it's important to note that a lot of people that you may be serving as medical professionals or health professionals do not have access to personal vehicles, and that cuts them off from a lot of the access to a healthy life currently. And so what we need are more options. Why do we have the system that we have? I will have to make sure, I have to make sure to mention that a history of industry lobbying and racism has shaped our transportation system. On the left is the case of racism. On the top left picture is a picture of in Detroit of the historic Black Bottom kind of neighborhood. This was one of the like very lively historically black neighborhoods. With the integration of things like redlining that were very race explicit, that that um, that areas, neighborhoods of color were given a much lower rating. And then also there's a lot of history of like some very explicit claims when people are trying to cite different highways of why one place might be the choice rather than another place due to race. So on the left, you see how the historic Black Bottom neighborhood in Detroit was kind of raised due to that kind of history of our highway system in the US. But that is not only just racism or like effect of the system of racism in our country. It's also shaped by history of industry lobbying. And so some original research from UCS, we've shown that over 75% of the kind of the spending that we do on transportation, whether that is due to owning a vehicle and maintaining and fueling those vehicles, or it's due to the trucking industry or things like that. Over 75% of that amount of money goes to the oil industry, the auto industry, and the road building industry. And so these are industries that are actively on Capitol Hill, in different state legislators, lobbying for this kind of highway-oriented car dependent status quo that in the end is quite unhealthy as well. As an alternative, we have found that more transportation choices, walking, biking, public transit, those are good for public health and the climate. According to some of our modeling, we found that a system with improved transportation options and reduced driving could save up to $200 billion in energy infrastructure costs due to lower energy demand. It saves over $120 billion in public health costs. And then also in the end can save a lot of people a lot of money, $5.9 trillion in vehicle ownership costs through 2050. Um, those are those are big numbers. And those both span climate, health, and the other economic ways that transportation affects our lives. You can read more about any of that kind of research in our report, Freedom to Move. And so, yeah, what's happening now? What can we do about it? At the federal level, for access, the next particular policy moment is in something called the Surface Transportation Reauthorization. This is a big bill that happens every 5 years. What you got to know about it is this affects kind of where federal money goes, whether it goes to highways or transit, and things like that. It's a legislative thing, so that means if you call your legislator, they will be able to be responsive to whatever you might be prioritizing. It's an important moment for constituents to really be reaching out and trying to affect policy change. Um, and then your voice definitely matters. As health professionals, being able to tie health and transportation and make that clear to decision makers is incredibly important. In addition, at the state level, there are a couple of other policies that are happening. In Massachusetts, there's a bill called the Freedom to Move Act, for instance, that seeks to align transportation plans with goals for reducing emissions, and then as a result, improving human health. And then that kind of similar kinds of bills are happening in, for instance, Maryland, where there's a bill to kind of add emissions impact assessments to large highway projects that are proposed in the state. So these can kind of add more scrutiny to some of the biggest projects that worsen emissions, climate change, things like that. That's access. Lastly, a short tidbit on phasing out petroleum. This is not the focus of my work, but I just want to make sure to convey to you all that this is something that UCS is definitely working on. It's a key battleground for kind of the future of the fossil fuel industry. Um, when you live near one of these fossil fuel facilities, such as oil refineries, those have particularly bad human health impacts for surrounding areas due to the many different kinds of pollutants that are happening there. But UCS is also working on things such as dynamics of food systems and biofuels, as well as um, the petroleum phase out in California and what happens to the future of the gasoline supply in California. So, if you're more curious about this, I would direct you to some of our other experts on this topic. Okay, what can we do about this? Um, it's a rough moment for transportation right now. The Trump administration has kind of weaponized Department of Transportation spending for their own authoritarian agenda. A lot of the times, for instance, in Colorado, they've been kind of hinging transportation funding on, on for like political retribution. There's like a case of a particular election denier in Colorado for which the Trump administration is withholding a lot of transportation funds for. But in addition, um, the administration has taken an axe to things like woke DEI policies, things they call the Green New Scam. It has been actively defunding kind of the research space surrounding all these kinds of things. Um, and also has been tying, for instance, transportation funding to immigration, something that has been recently struck down in the courts, and the Trump administration had to back away. So it's a rough time, but all that means is that in these times it's more important to stand up for science. It's important to build connections across our fields, transportation, health, climate, all the different fields. And it's also important to make sure to build your own skills to create the kind of change in the world that you want. And so that is one of the roles that UCS takes is we're here to help you build whatever skills you want to kind of be able to advocate, to be able to support science-based policies. What this can look like is, writing a guest blog about how public transit is important to human health, or it could be joining one of our skills-based trainings, writing an op-ed about the ways that transportation intersects with your own daily practice, or it could be, applying for things such as our Science for Public Good Fund, which helps support smaller group efforts such as student groups or things like that who really want to do a science policy kinds of initiative. There's also, for you all, I'd like to mention that there are many other health-oriented partners like American Lung Association, Physicians for Social Responsibility, American Public Health Association that are also doing a lot of good transportation work. They have a lot of materials out there as well about linking transportation and health. So just wanted to make sure to plug that. That's all I have to say. Thank you so much. If you want to learn more, I would encourage you to join our science network. It's ucs.org/science-network. And if you'd like to stay connected, please, you can see my email there and I'll put it in the chat too. But I'd love to kind of open it up for questions or discussion. I'd love to know how transportation is happening in all your work and any other reflections from what I had to say. Thank you.
Thank you so much. That this was excellent, and you touched on so many important areas. I know there are many physicians in the chat. There's folks from USDOT, so really I think a broad representation here. If people just, it's a small group. If you just want to unmute and share questions, maybe while people are thinking about questions, so many times. I've heard people refer back to the high-speed rail failure in California, and how do you combat some of that? Because I mean, obviously, it's been incredibly successful in China and Europe and all of these other places, and people always harp on that California example.
Yeah, I hear and I'd be curious what other folks, especially if you're in California, are hearing about this. For me, what I've heard is that the example of high-speed rail is one example of how we can improve, like we need to improve how we deliver these kinds of infrastructure projects. There's a lot of like things that people have been pointing to, but it's not a failure of, that we don't want this. Like high-speed rail would be a great thing. More transportation options are like something that many people say that they need. It's very important. Um, but there are ways that we can, improve the way we deliver infrastructure projects. There are ways that we can invest in kind of public governmental capacity to make sure that those projects are delivered better, that are incredibly important. But yeah, I wonder if people bring that up in like a health context, but like that would reduce emissions. It'd also give people more access to places that they need to go. So yeah, I can see a lot of implications.
I just two things. I'm here at the Wall Street Green Summit. I'm actually in a room. I'm attending the conference, but I'm taking time to listen to this. One of the things they're saying here is that China is literally decades ahead of us in terms of transportation, green transportation. Their EV vehicles are vastly superior to anything we have here, and the diffusion of the innovation is actually happening in China. Is there any way to like message that to see how quickly we can transform when we have to, and how important it is to basically keep up with what the rest of the world is doing in terms of transportation?
Yeah, I think in this particular moment, or it's definitely in transportation, like say, like things like US is the fourth, the US transportation system would be the fourth highest emitting country if it was a country. Like that's kind of surprising. Like we are behind. There's something wrong with that.
Only
Um,
4% of the world's population live in the United States.
and it's like it's not only China, like it's just the US is one big anomaly in terms of transportation. I will put in the chat, there is a report recently out by Transportation for America, for instance, especially on transit. It compares to a lot of like world-class cities out there and basically says, wow, the US is really far behind. Even a city like New York is very far behind many of the other cities' transit investment and amount of service that people have. I think there's a lot of potential right now to kind of use that as a messaging talking point. I will also mention that like it's hard and like or like particularly for me as a Chinese American person, it's hard and you got to be careful with this kinds of messaging about pitting two countries against each other. It's a race for whoever can do better or something like that. But to the extent that it helps, I'm sure there's a lot of good ways to talk about it.
Other questions from the group? I guess I had another question then too, just to, I've heard a good amount about the 15-minute cities and urban planning, just to kind of have these smaller hubs that may even negate as much of the need for public transit. Does that come up in your conversations about how to envision public transit in the future?
Yeah, definitely the 15-minute city is a very compelling concept. Um, I think what it points to as well is just
Can you
it's not
explain what it is in case people aren't familiar?
yeah, my understanding of 15-minute city is like it's planning the neighborhoods that we live in a way that you can get to everything you need to get to in 15 minutes, whether that's the grocery store or the doctor or whatever. Like it's all kind of nearby. And 15 minutes kind of walking distance, I think in particular, is something that they talk about. Um, but I think one of the big things that it points to is that you can't just like throw a bunch of buses at the current way our cities are planned and expect everything to work out. There's a lot of the ways that we planned our cities, the ways that like suburban sprawl, things like that, that make it in particular like a really uphill battle for trying to implement transit or anything else besides a car. And that was kind of by design. Um, but that's not something that can change. There's a lot of important ways that you can change the way we plan our neighborhoods to make them more convenient. I think there's like, in particular, one compelling argument I hear is about kind of for aging demographics or in rural areas, like when people age out of driving, like they just want like a neighborhood where they can walk around and get to the grocery store and do what they got to do, without having to do all that. So, um, the way we plan our neighborhoods is incredibly important. I'm sure it has a lot of other like human health or like health impacts as well. If you have access to everything, walking, it gets people walking more. Active lifestyles is a big portion of the health connection as well. Um, but yeah, I think one of the things that I've been feeling when I've been talking to health professionals as well, though, to kind of transition to a different topic, though, is like a lot of times health professionals focus like people are coming in the door because they have a health issue, and it's hard to go up the chain of like, oh, but a better neighborhood could help. Oh, but a better like a more walkable lifestyle, like or having access to public transit could help. Because like going up the chain is like much harder. I wonder if that like is a thought that other people resonate with as well.
There is another health question in the chat from Brianna. She's great talk. Has there been any research looking at the correlations between EV policy and implementation and air quality or public health outcomes?
I think I'm trying to think about this question. I think like in terms of if your question is specifically on like in a place with more EVs, has health been better? I'm struggling to think of something off the top of my head.
There are some, and Brianna, I'll see if I can find some of these studies. But I had heard about work in California where some of the cities converted to mainly EVs and how they had rapid improvement in their air quality and then decrease in respiratory admissions. But I'll see if I can find that while we're talking here.
Thanks so much, Lisa.
Great question. Could you maybe talk about some of the mental health benefits in that one study? Because I thought that was fascinating. I mean, you do just intuitively, like you interact with more people when you're on public transit. I would love to hear more about that.
Yeah, I think from what I saw in that study, there is it was particularly the time kind of the amount of time that you have to spend driving. That is like one of the big portions of the reasons why car dependence can kind of suck. Um, I think there's the social aspect as well. Um, I know there's a lot more research talking about like an active lifestyle and how that can help, um, and the ways that transportation options helps with that. Um, but yeah, it is something intuitive. There's always some headline that comes every once in a while that says like, oh, like, you know, a walkable neighborhood is pretty nice, right? I think there's this one article I was seeing as well that like that was talking about how it just makes people more irritable, like a car-oriented lifestyle, like generally just makes people more irritable and things like that. Um, so there's a lot of research out there. I'm gonna put the link in the chat if folks want to dig into that particular paper more.
Any other questions for Kevin? This is fascinating. Yes, Erin.
Um, yeah, hi. I have a number of questions, but I guess I'll pick. I would be curious to hear your thoughts on the mine train example. Are you familiar? Which is like an example of where, um, like in the US, I definitely want to see more high-speed trains here or high-speed trains at all here. And then I have been, just encountering people who are more on the limits to growth argument side of things who are concerned about high-speed trains. I ran into such people in Spain, and I was a little on, and like in Italy, there are people that don't want more development. And then this example in the Yucatan, I thought was well, I met someone here locally who was from the Yucatan and had been participated in a documentary about the flood, uh, community engagement, and indigenous like buy-in of like creating this huge train system where before it had just been little roads, which is just opening up opportunities for more like pricey tourism rather than like allowing people. So I guess I'm curious what your thoughts are on, transportation in contexts that are not already super developed, what's actually progress and what's actually like the democratic processes that we want to see around inequity. That those kind of broad topic. Does that make sense? Yeah.
Oh, totally. And it's something that definitely comes up like beyond definitely a lot in rail space because like rail stations can generate a lot of development. But I think this comes up as an argument in many other transit things, whether that's like a subway or I think sometimes they even talk about bus lines and economic development and displacement and things like that. But I think like the general argument is that like, oh, like because transit is a good thing and people would want to live there or do economic activity there. It's a good thing. And but many times people are definitely kind of with the history of the, how markets and land and stuff like that and displacement goes having a nice thing in your neighborhood can also mean that like you are priced out of it. And so I think it's something that I think that policy can solve is something that like there's like anti-displacement policies is making sure there's controls on affordable housing in the area, like all these kinds of things. Um, Authentic community engagement that like allows for those kinds of solutions to happen in an area. Um, but I think one of the ways that I've seen is just that, or one of the things that I've seen is that those kinds of arguments can often hinder like a project that would actively like benefit a lot of people in the community. Um, and so those are my where I sit in that tension, Aaron. Um, I hope that helps.
Great question. Yeah, and so much complexity, especially when you consider all the layers of policy that have to be surmounted with this.
Maybe I'll add as well, a lot of people focus on rail because it's very appealing. But in the US, like the bus is something that is very quickly implementable, serves a lot of people. It's the humble bus is something to not look over. Um,
We just started implementing electric buses in our public transit, and we're trying to get more electric school buses because I know that the EV school buses is a whole other conversation. Do you find that when you're trying to do this, do you try to launch both school buses and public transit buses concurrently? Is does that make it easier, or are they kind of separate issues?
yeah, there are definitely separate spheres in terms of like the buses are different, it's an agency procuring a bus versus a school district is are both very different situations. But I will note that those are both applications where the case for electric school buses and electric transit buses were one of the first kinds of applications of the bigger vehicles in terms of electrification. And I think people really recognized it in school districts. Like it was very clear that, having students breathe in diesel fumes all the time, or the huge parking lot with all the buses idling at the same time and having kids breathe that in is like not a good situation. It exacerbates asthma and all these kinds of things. And so that's a place where like there's a lot of energy, definitely, in terms of electrification. But I think there was a big EPA grant to try and help fund electric school buses. It also helps that like they have very predictable routes that are shorter, they run twice a day, they have time to charge, like all these kinds of things. Um, but yeah, I think it's definitely a place of that a lot of school districts should be prioritizing, but I know that like school district funding is a tough, like getting the capital to make this happen is a different story for education in the education space too. So
Yeah.
just a
And
couple thoughts.
James.
Yeah, just kind of adding on to this with a question. Um, I feel like at a couple of different climate and health related things, I've come across wearable devices as like a newer arm for localized, like very hyper localized and like this street versus that street type of research. And that in addition to heat being undercounted in certain areas, particularly traditionally underserved communities, with changes in tree cover and things like that. Air pollution has been another thing that's been commented on. Kevin, I wasn't sure, or anyone else on the call, if they'd come across just regarding the evidence for EVs and thinking about kids, because I've seen studies, so I don't have any like immediately available, that like the interior of the school bus has some of the like highest concentrate of the diesel school bus has some of the highest concentrations of PM 2.5 and all the other nasties. And and then additionally, like thinking about people on the sidewalk or in that parking lot, while you don't necessarily always need like clear health research to make policy worth implementing, like I think there's a billion other benefits to getting EVs, particularly in vulnerable populations like children on a school bus. I wasn't aware. I was wondering if you were aware of any specifically like wearable device, thinking about that as another arm to kind of show, in addition, because like right, you implement some EVs somewhere, and it's not necessarily going to change the regional effect or what census tract level effect, whatever AQI gets reported as. But it could still have significant life-changing effects for your kids that have asthma at a school.
Yeah, this is making me think of so in air quality world, there's like this big push for low cost air quality monitors. And some of those are stationary monitors, like I think they're called purple air monitors. But there's also some really, I don't know, heartwarming papers out there where there are these like particular like backpack air quality monitors or like wearable, not wearable, like it's like a little dangly thing. I have one over here actually. But they like give these to a bunch of students for a month and track their walk to school or something like that. And they are able to one, like study their like what the air pollution is like on the day to day. So it looks like one of these. Um, but then two, it's also like a really good like community science kind of thing too, to have students like learning about the air quality in their own community. These kinds of monitors are like not $10,000 regulatory grade things, but at least in terms of like really, but they can capture a lot of like the block to block kind of variation. It can pick up if there's like a big if all the school buses are idling in the parking lot or something like that, they can pick up on those things, and those are kind of useful insights for people to really get in touch with like the air they're breathing, which is often like an invisible thing for a lot of people. Um, I see Javen also is mentioning some other groups working on that kind of thing too.
This is so informative. Thank you all for helping me find some new resources.
I love that citizen scientist model too, Kevin. I just so I mean, purple air is certainly is great. I recently heard about the Zooniverse. Other people might be familiar with this. It's a whole citizen scientist platform that I guess it started off around astronomy. And you can submit projects to them, and I'm just kind of wondering, does Union of Concerned Scientists get involved with citizen scientist type of work, or would this be something that they might entertain?
I will say we haven't like led any projects or anything like that, but we do know the people who do. So if you're interested in getting involved in some project like that, like let us know. We can help make sure you're in good hands.
I'll drop the link for this in the chat because apparently they will accept projects that have a defined endpoint and if it's a viable project. So yeah, but I do love the idea of getting more people involved in this. Wonderful. Well, thank you so much, Kevin, for bringing this to the group, and we would love to have you back again because I think there's so much richness in this conversation. And thank you all for joining us today. Again, if you can all sign up for Climate Health Society, we certainly welcome more members, and we will continue to bring you more educational opportunities in the future. And thank you all.